Okay, so we have started the albuterol ipratropium nebulizer, 15 milligrams. We're starting IV methylprednisolone, 1 milligram per kilogram, equaling 109 milligrams. I'm about to administer that IV.
So, you guys have not seen any of this. Do you know what they're talking about?
140/88.
You have no patient name, no patient nothing. So I would stop them right now.
And I'm sorry, what is his oxygen saturation at this?
We need to know his name too.
His name's Patrick Armstrong, 16-year-old male, coming in with, he's in severe, he's reading out as severe respiratory distress right now, I believe, so.
Do you have a respiratory rate on him?
The last check we had was 28. We're starting his severe protocol. We are looking for a consult on starting continuous albuterol nebulizer.
Are you initiating the severe protocol for?
This was the protocol initiated by his doctor right now.
Based on his peak flow reading for asthma.
For asthma. Thank
okay.
you.
For his asthma action plan.
So we're looking for a consult on how to set up a continuous albuterol nebulizer for him at this point in his treatment.
What's his O2? You have him on oxygen right now.
Yep, 93%, 2 liters.
Continuous nebulizer, you're going to need to order it from the pharmacy.
Okay.
And then Respiratory can bring it to you and they will set it up for the patient. If you guys are going to set it up,
They don't have respiratory.
you don't have Respiratory. Okay, then we need to obtain it from pharmacy and it comes in kind of a bigger container because it lasts longer. And you would hook it to the oxygen or the airflow just the same as you do with the nebulizer.
Okay.
And put it on the patient. It takes about 3 hours to complete a container.
Really are taking so much time.
Right, but you need to.
Can I speak with one of the nurses, please?
Okay, hi, I'm Nurse Betsy here.
Hi,
Who am
Betsy.
I speaking
I'm Megan from Respiratory. We're just gonna help walk you through how to set up this nebulizer, the continuous. Okay. Are you guys ready? Are you ready for that then?
Sure.
You have the equipment there, correct?
We do.
So you guys have the albuterol medication, correct?
Yes, we do. Yeah.
Can you please show us the equipment that you do have so we can help you with this process?
Right over there.
Perfect.
Okay, that's great. So let's go ahead and open the bag.
Can you guys tell us what the physician told you for the order, how much to give?
It's albuterol, 15 milligrams per hour times 2 hours.
Okay. Can we talk to a nurse about the dosage of the medication?
Yes.
Okay. So in order to get the right dose, you're going to need to use 12 of the albuterol unit doses mixed with 60 milliliters of saline. Can you repeat that back to me, please?
So 12 unit doses of the albuterol and 60 milliliters of the normal saline mixed together in the bottle. Yes.
Perfect.
So 12 of these gets mixed with saline.
We have saline right there.
Am I mixing it in here?
Yes.
Can you guys have one person consulting RT the whole time? So we're only talking to one of you guys and not everybody?
Okay, so the medication needs to go in through the top of the container because the top will not come off.
Okay, so 12 unit doses in the top.
Okay.
And 60 mils of saline.
Okay.
And then we'll take off the nasal cannula.
Yeah.
Yes. You're going to want it to have a flow of 10 liters. After you remove the nasal cannula and hook up.
So when you guys are ready, you're going to take off the nasal cannula.
And you said that his O2 dropped.
It's at 87.
87? Okay, I would go ahead and turn the flow meter up to 4 and then get your volume nebulizers all ready to go and then hook it up and get him on that and then you can take the nasal cannula off.
You need to move the canister onto the oxygen source. It should not be connected with the tubing. The canister itself should screw onto your oxygen source.
Canister should screw onto the oxygen.
This? There should be an outlet on the top on the purple.
Yeah,
It should hook into the oxygen source. It might twist on.
right.
You might need a different adapter to the oxygen.
It goes on to your order.
It should be able to twist on.
So this is what they have. They may have something that doesn't twist on the top.
Okay, can you see a mist coming from the mask?
Yeah, we do.
Yes. Okay. Coach him on breathing. All right, when you take deep breaths, If you can, try to hold your breath so the medication gets deep in your lungs. Only for about a second and then just let it back out again. Only for about a second and then let it out.
His respiratory rate is 34, and we have an order to send him to critical care.
So at this point, we're going to virtually transfer him to Eau Claire. We'll have a few nursing students hand off